Hi, Dr. Hussaini here. Congratulations on getting your braces put on today. My staff and I are very excited about going on this journey with you. We put together this video for you so you have some instructions and some framework on how to take care of your braces as we go through this treatment with you. So I tell all my patients that orthodontic treatment can be likened to a team concept, where we have different players that are part of the team, and everybody has to do their part to make sure we're getting to the ideal goal that we're trying to achieve. Of course, one of the players in that is me and my staff over here. We have to make sure we're doing our part as far as executing and implementing your treatment. But the patients who are going through treatment, they have to make sure they're doing their part as well. Some of the important things with that is making sure you're keeping your teeth nice and clean. We will be showing you in this video how to brush, how to floss, so making sure you're doing your part at home, making sure you're getting your cleanings with your dentist on a regular basis, and if there are any appliances to wear, making sure you're wearing those appliances. If there are rubber bands, making sure you're wearing those rubber bands. And if the patient is a child and there are parents involved, then the parents have to do their part in terms of making sure they're keeping their appointments, they're bringing the child in regularly for their appointments. And as long as everybody is doing their parts, we will get to the beautiful smile that we're trying to achieve at the end of your treatment. Next, we're going to talk about how to brush and floss your teeth with braces. But before we get into that, I wanted to show you what happens if you're not doing your part brushing and flossing. This brochure right here, this shows you the different stages of the quality of brushing, with excellent at the top, and as we go towards the bottom, poor. And notice the quality of the gum tissue and the teeth and what's happening to the gum tissue and the teeth as we go further down this brochure. And then this picture in particular shows you a really poor example of brushing and flossing, where you can see the gum tissue is what we call inflamed, meaning it's puffy and red and swollen, and the plaque buildup, the white fuzzy stuff around the braces and around the teeth. And ultimately, if that continues throughout treatment, this picture right here shows you what happens and what your teeth look like at the end of your treatment when the braces are taken off. Your teeth are going to have these stains or these scars on them, and these scars are permanent. They will not go away. Over time, they might fade a little bit, but most of them stay. And you can see how the teeth themselves look nice and straight. You know, we have pretty much accomplished what we wanted to with your treatment, but the appearance of the teeth doesn't look so great because of those scars. So that's why it's very, very important that we take good care of your teeth and your gums as we go through the braces process. So this is how you brush your teeth with braces. Basically, for every tooth, there are 4 areas I would like for you to pay attention to. One is right under the braces, right next to your gum line, and over there you want to kind of angle your toothbrush up in this direction. Get up in there and make sure you get everything nice and clean. Then right above the braces, where you're angling your toothbrush down, making sure you're getting everything nice and clean. Then on top of your teeth, or the chewing surfaces of your teeth, making sure we're getting that nice and clean. And then the inside part of your teeth. Notice I'm making circular motions whenever I'm cleaning this, and as you go down your teeth, you can continue the circular motions. You do the same thing with a power toothbrush as well. If you do not have a power toothbrush, I highly recommend getting one with braces. We actually even sell those at our office, so you can ask our front desk staff if you're interested. The manual toothbrush will do the same. We just have to make sure we're putting the effort into it. The other part of brushing is this little guy right here. I like to call it a Christmas tree toothbrush. Kind of looks like a little Christmas tree. We call it a Proxy Brush. And what this allows you to do is get under the wire right next to the braces. So you can either go from beneath the wire right next to the braces and go up and down, get that cleaned up, or you can go from above the wire down right next to the braces and get that cleaned up. So the next thing we're going to talk about is how to floss with braces. The easiest way to do it is just to take your traditional string floss, grab one of the ends, and you're going to thread it through in between the teeth right behind the wire. Then you pull the end through and wrap it around your fingers like you normally do. Go up and down between the teeth and get both the teeth that you're in between. The only difference now is you have to pull the floss back out and then go back into the next set of teeth. So flossing with braces does take a little bit longer because you have to keep pulling it out and going back in. Now, if you're having a hard time flossing with traditional string floss because it's too flimsy and you're not able to thread it through, you can use this thing called the Floss Threader. It looks like a big flimsy needle essentially. What you do is you put the floss through this big end, the opening. Next. Now the other end of this is stiffer and it's much easier to control, so you can thread that through between the teeth. And now what you do is grab onto that stiff and grab on the other hand, grab onto the one end of the floss and simply pull through on the floss threader, and the other end of the floss comes through. Then you repeat like you did before, wrap it between your fingers, go up and down between the teeth, pull it out, and then go again with the floss threader. With the floss threader, of course, because there's an additional appliance involved, it does take a little bit longer. The last option you have with flossing is use something that Oral-B makes. It's called Super Floss. And what this is a string floss that has a stiff end already attached to it. So again, it's easy to control. You simply thread it through, pull it through, wrap it around your fingers, and go up and down. Patients who are having a hard time flossing with string floss, and there are a lot of patients that do because of braces, the next best thing that's available is a Waterpik. I always tell patients string floss works best. There's nothing that can do what a string floss can do. However, if you're having a hard time, then you can use a Waterpik as a substitute, and that is available for you in most pharmacies as well. One thing that you should expect with braces, you're going to get some small scrapes inside of your cheeks and your lips. Naturally, when you have braces on, the metal braces and the wires will cause some small scrapes and whatnot. So what you can use for that is what we call wax. It comes in a little case like this. You just open it up and the wax is in little tubes. You break off a very small bit, and you only need a very small amount. And what you want to do is roll it up between your fingers into a small ball. And now let's say this part, what we call the hook of this brace, is what's bugging you. So what you do is you take this wax, you simply press down on it and cover it up just like that. And now you have a soft covering on that brace, so it's not going to be bugging you. One thing with the wax though is if you try to eat with the wax on, most likely you're going to swallow it. So one thing you want to do is when it's time to eat, take the wax off, eat your food, brush your teeth, and put the wax on when you're done eating. The wax can also be used, sometimes the wires start poking out the very back end of the last brace. You can use the wax to cover that as well. Now, everything we just talked about with the brushing and the flossing and the wax, it can be found in this little kit that we're going to be giving you. You're going to be taking this home with you, and this pretty much has everything in it like we had discussed. It even has a travel toothbrush in it for children that are going to school. You can keep it in their backpack or wherever else you would like to keep it. Now, I want to take a quick second and talk to you about briefly what to expect with the braces the first few days. Right now, what you're experiencing with the wire we've placed on is a little bit of pressure. However, later on today, in a few hours, that pressure is going to start moving your teeth. And as your teeth start moving, you are going to experience some achiness and some soreness. That is normal. That is expected with the braces. In children, that soreness, that achiness tends to last anywhere from 3 to 5 days. In adults, it lasts a little bit longer, probably from 5 to 7 days. For that, only as needed. Everybody is different in terms of how they respond to the soreness. Some patients need some medication to help with that. Some patients are okay without it. So if needed, over-the-counter Tylenol helps with that. If Tylenol is not working, try Advil or Motrin. Just make sure you're not allergic to any of those medications, and just use the dosage that you normally use for the patient. And again, as needed. If you do not need it, you do not need to take it. The other thing that helps a lot with the soreness are soft foods. So in the beginning, you're probably going to be eating a lot of soups, milkshakes, pastas, rice, mashed potatoes, oatmeals, purees, those types of soft food items that will help deal with the soreness and not cause as much soreness of your teeth. So speaking of food, there are 3 categories of food items that you want to avoid with braces. Basically, remember anything hard, anything crunchy, and anything sticky. We are going to send this brochure home with you, and this brochure lists basically those 3 categories I just mentioned: hard, crunchy, sticky. And as you can see, it has some common examples of food items that exist out there. And just please remember, this brochure is not all-inclusive. There are a lot of other items out there that are not on this brochure. So again, the easiest thing to do is just remember the categories: anything hard, anything crunchy, anything sticky. Some other common items are pizzas. You're allowed to eat pizza, just not the crust on the outside of the pizza, the circular line outside of the pizza. And as far as fruits and vegetables that are on this list, they're perfectly fine to eat, just don't eat whole items. So do not bite into a whole apple or a whole carrot. For fruits, just cut them up into small pieces. For vegetables, good idea to cook them or boil them or steam them. That softens them up, like carrots and broccoli and celery and whatnot, and that makes it okay to eat with braces. Now, what happens if you are not following our instructions is the glue that's holding the braces onto your teeth, that can what we call break, meaning that basically comes off. And now we have to spend time to glue that brace back on your teeth. And if that keeps happening over and over again as we're going through your treatment, that can significantly delay the length of your treatment, which means your braces are on longer than we want for them to be. All right, now on the other side of this brochure, there's two other sections that are pretty important. This part right here talks about the different parts of the braces. If you ever need to call our office and you're not sure how to describe what you might be experiencing, this lists the different parts of the braces that you can use to describe. And then lastly, this section right here goes over some important tips that we might not have covered in this video, so you can read this over on your own time, and this will help you on your journey with braces as well. Now we just discussed what you need to do to avoid having the braces come off of your teeth. Having said that, sometimes even if you're following instructions, braces do happen to come off of your teeth. You just experienced the procedure of getting the braces put on. It's what we call a very technique-sensitive procedure, meaning you have to keep your teeth very nice and dry. You have to keep your lips away. You have to keep your cheeks away. And your mouth is a very wet environment. So even though no matter how hard we try, sometimes a drop or two of saliva can get on your teeth, and that can interfere with the bond strength or the strength of the glue that's holding the braces on your teeth. So sometimes braces do come off. If it comes off and it's actually not bothering the patient, it's just simply loose and dangling around and not bothering the patient, you do not need to do anything. You actually don't even need to call our office. We will wait for the next appointment. Let us know. We'll evaluate, and we will do what's in the best long-term interest of the treatment plan. Remember, braces, orthodontic treatment plans are long, and we want to do what's best to minimize the amount of time. So if I feel like it's best to fix the brace at that appointment, I will. But if I feel like it's best to hold off for a future appointment, I will hold off for a future appointment, and I'll let you know when you do come in. Now, having said that, if the loose brace is bothering the patient, if it's poking their cheeks or poking their gums, then please give us a call. We do not want the patient to be uncomfortable until the next appointment either. So we'll schedule a patient for what we call an emergency appointment. Basically, at that appointment, we will remove the brace or cut the wire or whatever we need to do to make the patient comfortable. But please know that during the emergency appointment, it's a very quick appointment just to make the patient comfortable. We will not actually be fixing the brace back on the tooth during that appointment. So I hope you were paying attention in that video. There was a lot of important information. If you did miss some parts of it, this video is available online on our YouTube channel, so you can go online and take a look at your own convenience. But we're super excited to have you as a patient here, and my staff and I are really looking forward to getting you the smile of your dreams.